Hey everybody, my name is Dr. Scott Giacomucci. I'm the author of Trauma-Informed Principles in Group Therapy, Psychodrama, and Organizations, Action Methods for Leadership. And today I wanted to take some time to go over Chapter 8 in this new book, which is focused on the fourth of the 6 trauma-informed principles outlined by SAMHSA, which is collaboration and mutuality. So this chapter is titled Collaboration and Mutuality in Group Therapy, Psychodrama, and in Leadership. So before diving into this, I want to highlight how these 6 trauma-informed principles, although we're going to talk about them separately, they really go hand in hand. We can't fully embody collaboration and mutuality, the spirit of it, without also considering the other 5 trauma-informed principles. So I encourage you to check out some of the other videos on the channel here to familiarize yourself with the other 5 trauma-informed principles. So collaboration and mutuality, these two go hand in hand. And collaboration, of course, means that we're approaching the work through the spirit of partnership, of collaboration. And mutuality is about a mutual respect, that we're seeing the goodness and the positive qualities within the other. Of course, in the moment of trauma, mutuality completely disintegrates. There is no mutual respect in the moment of trauma. And the possibility of collaboration is entirely lost in a moment of trauma. Instead, there's a resulting sense of unworthiness and self-hatred, which can really complicate a trauma survivor's search for belonging, for self-love, and for purpose. Group work and psychodrama offer avenues for participants to experience and engage in collaboration and mutuality while recovering that self-worth and experiencing a sense of belonging within the group experience. Same is possible in organizational settings, that there's a real possibility for a healing and restorative sense of mutuality within an organization, mutual respect between colleagues, and a sense of belonging in a healthy organization. Collaboration and belonging are equally important in organizations as they help staff feel a part of, and they help staff feel purpose-driven and valued. Trauma is really characterized by the absence of collaboration and mutuality. There's no room for authentic collaboration or mutuality in the midst of trauma, in the midst of collective trauma such as racism or sexism, gender violence, or any kind of discrimination. The extraordinary imbalance of power in trauma can only be reversed through a healing process that really centers collaboration and centers mutuality within that healing process. Collaboration means that trauma survivors must be approached as active agents in their own healing process, rather than simply as patients that are receiving treatment from a provider. Collaboration in trauma-informed care means that we do with the client rather than do for or do to the client. This is a challenge for many agencies whose practices are going to be entrenched in the medical model of treatment and bureaucratic standards or even really sterile systems that tend to reenact power dynamics. For example, in many organizations, the process of treatment planning becomes really cookie cutter and templated jargon for compliance reasons rather than a collaborative experience with a client. Or groups start to become all manualized and sterile, and there's no room for mutual aid and collaboration. Instead, we're giving out worksheets and reading off of a script. Instead of therapists being dynamic healers in the here and now. Or we might have such stringent documentation requirements fueled by insurance companies or other regulatory demands that turn therapists into case managers and into administrators who don't actually have time to do therapy. I've seen this again and again in agencies. Therapists become so burnt out, and other staff so burnt out, and this burnout fuels more of the same, that staff are more likely to just go through the motions and follow the path of least resistance in their work rather than to really engage creatively and authentically with the clients and with colleagues. Many times, policymakers and leaders contribute to this, making decisions without frontline workers or clients who are going to be impacted by the new policies. So, collaboration and mutuality are especially important. Now, there was a seminal text on trauma informed care in 2001 from Harris and Fallett, and they state that the core of the service relationship in a trauma informed system is open and genuine collaboration between provider and consumer at all phases of service delivery. So, I want to challenge us to reflect on how can we further approach clients as active collaborators in our work with them, regardless of our role. Mutuality means that we connect with others, helping them feel seen, helping them feel heard, loved, valued, and empowered, and helping to cultivate a sense of belonging for everybody is really crucial to this effect. This means we have to develop atmospheres of mutual respect throughout our workplaces and our groups and in how we're providing services to clients. Perhaps we must look beyond only applying mutuality to trauma survivors and staff and also consider the importance of looking at trauma perpetrators through this lens as well. Many times, perpetrators are also victims of trauma. We spend a lot of time dehumanizing perpetrators, which really doesn't help them heal and doesn't help prevent future trauma. In my own work with folks with trauma, substance use, and in the prison systems, I find again and again that many times the folks who have hurt others are also folks that have been taken advantage of themselves, who have experienced their own trauma, their own loss, their own abandonment or neglect. And so I've found that the best way to help prevent future trauma is to cultivate healing for everybody, including perpetrators. We can't just dehumanize them and write them off. We really have to also work towards healing for everybody. So I want to challenge us to also see perpetrators most of the time as human beings who are also in pain themselves. Furthermore, we also have to apply this sense of mutual respect to ourselves. Many times as helping professionals, we might be quick to offer mutual respect to others, but we might not show the same respect and care to ourselves. This means that we have to recognize our own needs, our own wants, our own strengths, and our own goodness. We're going to really struggle to collaborate with others until we come to believe that our own ideas are also worth consideration. And it's good role modeling for clients and for those that we're working with. Implementing these trauma-informed principles really requires the vehicle of a relationship between two parties for them to manifest. We can't engage in collaboration unless we're collaborating with somebody else. It's not something that can be done alone. I want to challenge us to pause for a moment and reflect on some questions. Or do I fully recognize my own worth, my own strengths as a professional and as a human being? And how can those that I work with further recognize their inherent worth and strengths? How can I help them further recognize that their ideas are important, that their past experience is meaningful, and that they bring something important to the table that's worth exploring and collaborating with? In the context of mutuality, we also have to consider mutuality as being connected to a sense of respect for identity and for culture. So mutuality is connected to the sixth trauma-informed principle, which urges us to consider the impact of culture, history, gender, and issues of identity. We can't fully cultivate a sense of belongingness for someone within our group, within our organization, if we don't consider and respect their identities and their culture and their background. Trauma-informed care implies that we have to create a culture within our organizations where the staff, the clients, the leaders are all treated with respect, regardless of their identities. Leaders must be willing to utilize their privilege in responsible ways and to take responsibility for healing from the ways that maybe we've been marginalized in the past. So leaders have both of these responsibilities. Leaders who have not worked through their own trauma are likely to cause harm to others, or at least will be limited in reaching their full potential as a leader. So it's really important as leaders that we're looking at our own past wounds and actively working to heal from them. Leaders who are unable to critically examine their own privilege while creatively leveraging it for good are also missing the mark on being the best leader that they can be and risking reenacting oppression or microaggressions with staff or with clients. This type of mutuality in relationships with clients and staff has to be more than performative. We can't just talk about it. We can't just make a YouTube video about it. We can't just tell others about how important it is to do or put it on our website or celebrate other holidays or send emails about it. It has to be authentic and it has to be action-based rather than just a public relations show. So I want to challenge you to consider and reflect on, how do you actively cultivate mutuality and belonging in your work, especially with folks from marginalized backgrounds or with folks from different backgrounds than your own. This fourth trauma-informed principle of mutuality and collaboration is also really important in group therapy settings. Group really gives us an opportunity to experience a sense of belonging and collaboration and mutual respect. Trauma-informed groups especially promote a powerful sense of belonging for participants of that group. Many trauma survivors are going to struggle with a sense of belonging, which can result from their traumatic wound. Some have said that if we've been wounded in groups, then it makes sense that the healing must also come in groups. Judith Herman, who's a famous trauma expert, in her book Trauma and Recovery, provides a really powerful argument for groups as a remedy for trauma, as an avenue for healing from trauma. She writes that the solidarity of the group provides the strongest protection against terror and despair, and the strongest antidote to traumatic experience. Trauma isolates. The group recreates a sense of belonging. Trauma shames and stigmatizes. The group bears witness and affirms. Trauma degrades the victim, and the group exalts her. Trauma dehumanizes the victim. The group restores her humanity. I thought this was a really powerful quote from Judith Herman that really highlights the importance of group work in healing from trauma. Of course, not every participant in a group is going to feel as though they belong in every group, and perhaps there's different groups for different people. Nevertheless, as group workers, we have to ensure that our groups create a sense of belonging for those that the group was designed to serve. We have to ensure that our groups are not unknowingly unwelcoming or rejecting others, especially when we've actively invited them into the group. Of course, some groups are going to have exclusionary and inclusionary criteria or be created for certain populations or folks experiencing certain issues, and that's okay. But we need to make sure that the group is a welcoming place that promotes a sense of belonging for those that are there in the group. A sense of belonging is often included in discussions of diversity, equity, inclusion in group work as well. Belonging is elevated beyond simply being given a space or a voice, but to include that one's voice is heard and responded to by others. So we can't just give someone from a marginalized background space. We can't just give them a voice, but we also have to hear their voice and respond to their voice, which creates a sense of belonging. Samsa actually describes group cohesiveness as being related to the sense of belonging that an individual experiences in the group. So we can see that there's even a connection between group cohesion and mutuality and belonging. This principle of collaboration really speaks to the shared purpose and vision and goals within a group, that collective reason why the group is there and what the collective goal is together. A cohesive and collaborative group process promotes the presence of therapeutic factors that were outlined by Yalom, especially those of a social nature, such as the imparting of information, altruism, the development of socializing techniques, imitation behavior, and interpersonal learning. Collaboration and mutuality often exist in a reciprocal relationship with each other in cohesive groups. That the more collaboration there is, the more a sense of mutuality and mutual respect is going to emerge. And the more mutual respect we have for others, the more collaboration we're naturally going to engage in. This fourth trauma-informed principle of collaboration and mutuality is also really important in organizational settings. A workplace atmosphere that embodies collaboration and mutuality seems to have a positive impact on the worker's self-worth, on their self-esteem, on their level of confidence, well-being, job satisfaction, performance, while also reducing social isolation. One research study even discovered a connection between the worker's sense of belonging at their place of employment and depression symptoms. So the more somebody feels like they belong in their workplace, the lower their depression is going to be. Another study in 2009 highlighted the importance and effectiveness of peer support, mutuality, and a collaborative workplace as factors that reduce secondary traumatic stress, vicarious trauma for folks working in domestic violence, interpersonal, for folks working in the domestic violence or IPV field as advocates. Furthermore, another study just a couple years ago explored 94 different workplace teams and summarized the central role that mutuality plays in promoting high-quality connection, resilience in the workplace, and performance within organizational teams. So organizations where individuals struggle to collaborate with each other are going to be ripe with conflict, with mistrust, with abuses of power, inefficiencies, and an overall experience of feeling ineffective at meeting the goals and the mission of the organization. So collaboration and mutuality are really key and important for effective teams, effective workplaces. A collaborative leader is quick to ask staff for feedback, to listen to staff when they give feedback, and to create changes based on the ideas of team members and community members and clients, customers. I want to challenge us to take a moment and reflect on, do we really treat everyone in the organization with equal respect, regardless of their role, regardless of their title, regardless of their identity? And are there ways that we could, as leaders, as professionals, engage in asking for feedback more frequently from the folks we're working with, from clients, from supervisees, from colleagues? How could we further engage in collaboration? Next, I want to talk about this fourth trauma-informed principle of collaboration and mutuality as it relates to psychodrama practice specifically. So psychodrama philosophy, psychodrama practice really inherently emphasizes collaboration and mutuality as core elements. And this is really articulated through Jacob Moreno, the founder's philosophy of co-creation and co-responsibility. So he argued that everybody in the group was co-responsible for the group and that everybody in society was co-responsible for society. And he suggested that each participant in a group setting could be a therapeutic agent for each of the other participants in the setting. And that part of our role as group leaders and psychodramatists was to create devices that positioned individuals to support each other, to collaborate with each other, and to promote healing with each other. So this is a really empowering philosophy. This role expectation that we might put on participants through this belief that each person is a therapeutic agent for every other person in the group, we're going to put a role expectation on participants, which is going to promote co-creation. It's going to help participants increase their sense of ownership over the group. Moreno went as far as arguing that the Hippocratic Oath should be extended to all patients and all participants in the group. Just like the therapist, every patient is entrusted to protect the welfare of the co-patients. He was a bit radical in his ideas, and especially in this idea, which is outlined in his Code of Ethics for group psychotherapy and psychodrama. But if you think about it a bit, it makes sense. I mean, some of the core aspects of the Hippocratic Oath, such as confidentiality, do no harm, treat everybody as equals, and use all the resources available to you to help the person in front of you, these are probably good things to ask other participants in a therapy group to commit to as well. The psychodramatic method and the process of engaging in psychodrama role plays is a very collaborative and co-created process, and it's co-created between the director, the protagonist, and the entire group. Most of the time when I facilitate a psychodrama session, I go into the group with a warm-up, and after the warm-up, I have the group propose topics, propose issues, propose goals that they need to work on. The group collectively chooses a goal and a topic and a protagonist, and we collaborate on creating some sort of psychodrama scene that addresses the issue, achieves the contract we've established for the session, and meets the goals that were articulated by the group. So it's really a collaborative process. I don't know what the topic or goal or roles are going to be before I walk into a psychodrama group. It's all spontaneously created together throughout the process. In this way, the protagonists and the group are really empowered as experts in their experience. The protagonist and the other roles in the scene are often consulted for their wisdom on where to go next in the scene. A psychodrama simply can't be facilitated without collaboration. It's such a protagonist-centered and group-centered method rather than being a facilitator-centered method. The group's collaborative process really pulls in participants as equals and as co-creators, utilizing their strength in service of the entire group. And there's really this sort of catching force that a psychodrama session has, that even people who initially said they want to observe, they don't want to participate, they end up often getting drawn into it because of the power of it, because of the relatability of it, because of the creativity or spontaneity of it, or because of their desire to want to help the protagonist and the rest of the group. So the imprint of the past victim and perpetrator imbalance of power is naturally renegotiated through collaboration and mutuality within a psychodrama context. So as trauma-informed psychodramatists, trauma-informed leaders, trauma-informed group therapists, we really have to be integrating this trauma-informed principle, collaboration and mutuality, into our work. And there's lots of different ways to do that. We're really working towards cultivating a sense of belonging for everybody in the group, everybody in the session, everybody in the organization. And I just want to remind us that this fourth trauma-informed principle, although we're talking about it on its own and separately, it's intimately connected to the other trauma-informed principles. We can't fully embody collaboration and mutuality without addressing the other principles, safety and peer support and trust and empowerment and issues related to identity. So I really want to encourage you to check out some of the other videos on this channel that discuss the other trauma-informed principles. I hope you found this video helpful, and if you did, I encourage you to like the video, subscribe to our channel to receive updates about forthcoming videos, and leave a comment. Tell us what you found helpful. Tell us if you think there was something missing that we didn't think about for this video. Let us know the specific ways that you engage in collaboration and mutuality and cultivating a sense of belongingness in your work, in your organization, and in your groups.